Welcome back to the Elder Wisdom Info channel. Have you ever felt a minor ache somewhere in your body and immediately shrugged it off as something unimportant? As we grow older, this kind of thinking becomes common. We chalk up discomfort to aging, sleeping in the wrong position, or simply overdoing it a little the day before. But it's crucial to understand that our bodies are always communicating with us, even if the signals are subtle. That tiny ache you felt? It might not be just aging. It might be your body quietly sounding the alarm. Unfortunately, many older adults ignore these signs until the situation becomes much more serious. In today's video, we're going to highlight 8 parts of the body where even a small ache or unusual sensation could point to a dangerous, even life-threatening condition. It's information that could not only improve your quality of life, it might just save it. Ache in the upper abdomen. Discomfort in the upper abdomen is easy to dismiss. It might feel like gas, mild indigestion, or even muscle strain. However, in older adults, especially those over 60, a dull ache just below the rib cage could point to something much more serious, such as early pancreatic disease, including cancer. Pancreatic issues are particularly dangerous because they don't usually cause sharp, dramatic pain early on. Instead, the ache tends to be persistent and vague, and it may radiate into the back or worsen after eating or lying down. It may not come with other obvious symptoms like fever or nausea, but weight loss, loss of appetite, or pale, greasy stools can also be warning signs. One example is Gerald, a 72-year-old who thought he was dealing with heartburn. But after speaking to his doctor and getting screened, he was diagnosed with early-stage pancreatic cancer. It was caught just in time. A quiet ache turned out to be a life-saving clue. Ache in the lower back. Lower back pain is one of the most common complaints among older adults, and in most cases, it's related to things like poor posture, arthritis, or old injuries. But not all lower back pain is musculoskeletal. Sometimes it originates from deeper and more dangerous sources, such as the kidneys or the abdominal aorta. Kidney pain may begin as a dull ache that's felt more strongly at night or when resting. It might not come with fever, burning urination, or other obvious urinary symptoms. A more urgent risk is an abdominal aortic aneurysm, a dangerous condition where the large blood vessel in the abdomen begins to bulge. This type of pain is often steady, in the same spot, and may come with other subtle clues, like a pulsing sensation in the abdomen, leg swelling, or unexplained fatigue. If stretching, resting, or applying heat doesn't ease your back pain, especially if it keeps coming back, don't wait. Get it checked. Ache in the center of the chest pain is one of those symptoms we're trained to take seriously, but what if it doesn't feel like pain? Exactly. What if it's just a little tightness, pressure, or discomfort in the middle of your chest, especially when you're walking or eating a heavy meal? Many older adults assume it's just gas or heartburn, but it could be angina, a warning sign that your heart isn't getting enough blood. It may not feel dramatic. It may not drop you to the floor, but it's your heart's way of waving a yellow flag. This kind of discomfort often goes away with rest, but returns when you exert yourself. You may also notice shortness of breath, lightheadedness, or cold sweats. A woman named Marlene, age 74, thought it was indigestion when she felt pressure while walking to her mailbox. Her doctor later discovered she had 2 narrowed arteries. That mild discomfort was her heart calling out for help. Ache in the jaw or left shoulder. When you think about signs of heart trouble, jaw or shoulder pain probably isn't the first thing that comes to mind. But for many people, especially women, these can be early warning signs of heart disease. This type of pain is called referred pain, meaning the discomfort is felt in one area, but the real problem lies elsewhere. In this case, the issue could be in your heart. The ache may come on during physical exertion or emotional stress and then fade away with rest. It often doesn't feel severe, which makes it easy to ignore. Linda, a 68-year-old woman, experienced aching in her jaw and went to the dentist, thinking it might be a tooth problem. The dentist found nothing wrong with her mouth and wisely suggested she see a cardiologist. Further testing revealed she had coronary artery disease. If you ever feel unexplained jaw or shoulder pain, especially during activity, don't wait. Take it seriously. Ache in the lower right abdomen. An ache in the lower right side of your abdomen might seem harmless at first, perhaps just a little digestive discomfort or something you ate. But in older adults, this kind of pain can be far more serious than it initially appears. The lower right abdomen is where the appendix is located, and while appendicitis is more common in younger people, it still occurs in older adults, often with fewer obvious symptoms. Instead of the sharp pain and fever we associate with it, seniors may experience a vague, lingering ache that worsens with movement but doesn't feel like an emergency. Additionally, conditions like diverticulitis, hernias, or even early signs of colon cancer can also begin with subtle abdominal discomfort in this area. Alan, age 76, ignored a dull ache for nearly 2 weeks before seeking help. By then, his appendix was inflamed and at risk of rupturing. His story reminds us, don't dismiss a strange abdominal ache. It could be something serious. Ache behind the knee. Many people assume that a sore knee is simply a result of age-related joint wear, and in most cases, they're right. But when the ache is concentrated behind the knee and doesn't respond to movement or rest, it could signal something far more dangerous, deep vein thrombosis (DVT). DVT occurs when a blood clot forms in a deep vein, typically in the leg, and can lead to life-threatening complications if the clot travels to the lungs. The tricky part is that DVT often begins subtly, with only mild discomfort, a feeling of tightness, or a slightly heavy sensation in one leg. Swelling, warmth, and redness may or may not be present. Richard, age 81, thought he just had a sore knee, but when climbing stairs left him unexpectedly short of breath, he got checked and learned he had a clot. If one leg aches persistently, feels heavier, or looks different from the other, especially after long periods of sitting, seek help immediately. Ache in the pelvis or groin area, a dull ache or pressure deep in the pelvis or groin is often overlooked, especially if it comes on gradually or seems unrelated to movement. Many older men, in particular, attribute this discomfort to normal aging or prolonged sitting. But that deep, nagging sensation could point to more serious health concerns, including prostate enlargement, bladder issues, or even early-stage cancer. This kind of ache may feel more like a fullness or pressure than actual pain, and it may come with subtle symptoms like urinary changes, an increased need to urinate at night, or a weak stream. Dennis, a 75-year-old retiree, experienced a mild ache while sitting, but ignored it until his daughter convinced him to see his doctor. Tests revealed early prostate changes, and thanks to early detection, treatment could begin before it progressed. The lesson is clear. Even discomfort that isn't sharp or severe deserves your attention, especially when it involves such a vital area of the body. Closing message. If you found this information helpful, drop #7 in the comments to let us know you're still with us, and more importantly, still taking your health seriously. As we age, it's not uncommon to feel odd aches and sensations from time to time. But the key is knowing which ones to watch and when to act. The truth is, the body doesn't always shout when something's wrong. Sometimes it just whispers. Staying informed, alert, and proactive is one of the best gifts you can give yourself and those who love you. Subscribe to the Elder Wisdom Info channel and turn on notifications so you never miss a life-saving tip or wellness insight. Remember, the sooner you listen to your body and speak with your doctor about something that doesn't feel right, the better your chances of catching serious issues early. Don't wait for the pain to get worse. Act while it's still whispering.